Today's webinar, Working with Muslim Individuals and Families, Culturally Competent Care, Part 2, led by Rupa Katapa. The Muslim community within California, as well as the entire U.S., is one of the largest growing communities and encompasses a set of extremely diverse histories, ethnicities, educational backgrounds, socioeconomic status and beliefs, views, and values. This rich diversity necessitates effective and culturally appropriate case management appraisal techniques while working with Muslim individuals and families. Our goal by the end of this webinar is for you, the audience, to be able to demonstrate an understanding of the contributing factors that comprise the Muslim identity, develop knowledge of some core values and beliefs that guide the experience of psychological distress and help-seeking behaviors within Muslim individuals and their families, identify and analyze OCAT engagement and appraisal techniques that can be utilized when working with the Muslim population. As mentioned, this is the Part 2 webinar. Today's webinar, as well as last Part 1's webinar, will be posted on the Learning Center within 2 weeks. We have expanded the time for today's webinar based on the overwhelming feedback that we received from this first webinar, and the questions that you have all posed following that first webinar, Rupa will be addressing today as well. Another logistical detail is that there are 2 handouts that goes with today's webinar. If you go to the handout pod, you'll be able to download those, but we'll also be posting those handouts on the Learning Center. Next slide. In the interest of time, I'll let you read Rupa's bio. For those of you who are not familiar with her, she obviously has a wide range of experience, and we're very excited to be hearing more about what she will be sharing with us today. Next slide. We, of course, want to hear your experiences, your recommendations, and challenges delivering cultural competent OCAT appraisals. Please don't be shy with sharing your knowledge and questions. Throughout the webinar, you can post your questions in the questions pod, and we will be monitoring them and posing them to Rupa at the end of the webinar. Next slide. At the end of the webinar, we will have a quick evaluation poll, which you can respond to by clicking on one of the radio buttons next to your preferred response. Your feedback is very important for us as we shape and design future technical assistance. And again, all materials from today's webinar, including the slides, the recording, the questions and answering, the handouts will be posted on the Learning Center. With that, I will turn it over to Rupa.
Thank you, Christina. I hope everybody can hear me clearly, because I just want to make sure that the air conditioning is running, and I don't know if there's any noise. Brianna, you can let me know. So again, welcome and to the second part of this presentation. Thank you to all who were there last time and those who have joined us this time. I would just like to start by saying thank you to all of you for the work that you do every day of your lives, and for your interest and inclination in wanting to learn more about this population. I do want to kind of just put it out there, and I'm not sure if I had mentioned this in the last presentation, that I am a non-Muslim provider. So I want to put it out there. I do not practice the Muslim faith. And what I bring to you today and what I shared with you last time was also learned from my professional experiences with my clients. I have over 17 years of working with this population from varied countries and varied communities. I also grew up in India with a large Muslim population and had a lot of interactions with friends and family who were from this community. So I really bring in what I've learned, and most of it has been learned as I've gone along, and I'm continuing to learn as I work with this population. And I've realized how important it is to get a sense of the identity, the person that you're working with. Having said that it's important to learn about the population, I do want to emphasize very clearly that there is a great danger to stereotyping human beings, right? So in these situations, it frightens me because a little bit of information can lead to stereotyping individuals into these boxes that we create for them. So I would really encourage you and request you not to use this information to put people into boxes, but really look at every individual as a human being, as an individual first, every family, not by what you see in terms of their color or religion or code of dress or what they're saying, but really who they are as human beings. So I'd really like to kind of say that before I start this presentation, because this information is really to provide a contextual framework for you, so you can hold that as you communicate, engage, and work with individuals and families who identify as Muslim. So this workshop, we focus on really, again, understanding the cultural and religious identity. And I would like to emphasize again that there is a difference between a cultural belief systems and cultural identities, as well as the religious. They're two different things. And quite often we kind of look at it as one. So I'm going to, talk about a few examples where some of the things are directly related to the religion and some are purely cultural, dependent on the community that you're working in. Even within families from the same community, you can have different cultural practices. So some of the challenges and risk factors, and how to conduct a culturally competent appraisal when using the OCAT appraisal tool. And this is something that I've used more in the previous presentation, but I will be referring to it, even though I don't have slides that actually show the tools. I'd refer you to go back to the previous recorded PowerPoint and look at the tools that have been posted in that presentation. And then understanding how you can effectively engage with this population and some intervention strategies. And I would like to keep the last 20 minutes of this presentation for questions and a discussion, so that we can talk and address some of the concerns that you may have in your work. So I just want to be able to summarize the identity piece of it before we move on to the cultural competency piece of it, because I think it's important to keep in your mind how an individual belonging to this community may be perceiving themselves and how they may be perceiving the world, and what are some of the variables or some of the factors that play into their understanding of themselves and how they understand the world. So and in this regard, again, if we are looking at an individual who does follow the faith, who is practicing the religion, then we would be looking at some of these things. Even if somebody is of the Muslim community, has been born into a family that is practicing the faith but is currently not practicing it, some of these sort of beliefs and practices may have had a huge influence in this individual. So irrespective, it's important to understand the basic core of this foundation of this identity. So understanding, to be able to understand that, is very important that we understand Islam. We understand what the base of that is and where these belief systems are coming from, and how the Holy Quran actually guides these behaviors. So Islam is a monotheistic religion from, following based on the revelations of Prophet Muhammad from 1400 years ago. And it is all recorded in the sacred Holy Quran, as we say it, right? Islam in Arabic means submission to the will of God. And sometimes this word submission is taken somewhat in a negative connotation. It really is not. It's a very empowering word. And I'd like us to think of it in that way. When you're submitting to the will of Allah or will of God, it really is that attachment that we look at. And if when we go back to social work theories and we learn about the attachment theory, many of you may have heard about it or read about it. Attachment theory really believes that their secure attachment links us to overall well-being, right? And in this community, the attachment to the will of God, or the attachment to God, really can lead a person to this overall sense of well-being. So I'd like you to keep that in mind. Islam provides a framework. So it's not just about religion and religious practice. It is really a way of life. It really provides a framework for how people wish to, respond to certain crises in their life, how they view others, how they view marriage, how they view death, how they view birth, all of that. So it really prescribes, it's very prescriptive in nature, really prescribes a human being's interactions with God. It prescribes the human being's interaction with other human beings. So this is the two paths that primarily guide a person's life: our relationship with God and our relationship with each other. And Sharia, the word that you may have heard again in a very negative, with a negative connotation about the Sharia law, many of you may have heard about it, or if you have not, it really means the path. And it translates into the path to life-giving water, right? So that's the actual translation in the Holy Quran, because it really is used as a spiritual metaphor to how water is significant in a barren desert. So if you look at it in terms of people following the path, it really indicates that someone is looking for meaning, someone is looking for the way to reaching a place that is better, right? So that is what Sharia actually means, as it is defined in the Holy Quran. And religion is often significant, if not the most important, psychosocial factor in their identity. And it's not religion and spirituality, again, not mutually exclusive. They can be very much inclusive. And Islam highlights the importance of community. I cannot begin to tell you how important this is this focus on the external world rather than on the internal world. And when we think about, and we'll look at this a little bit more in the later on, when we look at individualistic based societies versus collective based societies, right? And I remember when I first went to social work school in the US, I was taught about pull yourself up by your bootstraps, right? As the individualistic core of like self-determination and achieving success and all of that. And it didn't make any sense to me, because I grew up and I was raised in a collective structure where we were always asked to focus our future, including others around us, our families, our communities. And so this idea of looking inward and hoping that you are responsible for your future was somewhat of an alien concept for me. And I can therefore relate very well with the Muslim community in this regard. Is this identity is really framed by the external world, where if you tell me I'm a good person, then I'm a good person. And every decision that I make is really going to be thought out in how it impacts those around me and not just how it impacts me. So if that makes any sense. So in looking at the family structure and values, again, I've pulled out a few slides from the last presentation just to kind of summarize the core issues that we want to keep in mind. So it is collectivist, patriarchal family system in most community, in most of these, different communities, whether they're coming from whatever country. They're group focused and allocentric. There is a definitive hierarchical structure based on age and gender. So for example, the male is looked at in a more superior position than the female. But if there is an older female who is, significantly older and has sort of a status in the family, then that person also has a significant amount of power within that structure. Firstborn child, especially male, has significant authority. Male children are often equated with prosperity. And some of this, again, the male children, for example, this point is something that is more cultural than religious. So in many families and in some communities in Southeast Asia, for example, Cambodia, female children are given a lot of importance, and quite often females in a sort of a matriarchal environment are given a lot of power, right? But in many of the communities, male children, as we call them, the son preference is significantly high. And therefore, for example, if I'm a mother, if I have given birth to a son versus a daughter, I get a lot more status if my children are males as opposed to females, right? So it definitely is something that gives a woman status and power within the family, but a male child is also revered as just based on his gender. There are negative emotional expression is perceived as indicative of unhealthy self-absorption. So somebody who is hyperventilating all the time, or is explaining how depressed they are, or is very emotionally dysregulated. And some of those emotions that we would consider normal in this Western environment would be seen as self-absorption, as somebody who's vain, right, who's extremely sort of engrossed in their own self. And quite often that, because there is no permission to explain or to express oneself emotionally, it sort of manifests itself in somatization. So a lot of times people will not talk about how sad they are, but they'll talk about how how often they get headaches and back pain, and how fatigued they feel. So they won't talk about their emotions, but they sort of kind of leads on to the behavioral sort of functions or representation of that emotional state. And then, of course, we look at what constitutes a family. Quite often over here, we look at the mother, father, the children as the nuclear sort of family structure. But again, and this is very similar to many other communities or non-Muslim as well, where at the African American culture, for example, or the Asian culture, we quite often look at extended family members as part of the family, right? So I know over here we use the word traditional family, nuclear family, but within Muslim communities, I always make sure that I ask who's included within that family from the client's perspective, right? So it could be aunts, uncles, could be cousins, could be grandparents. So you want to be able to understand what that family structure looks like. There are some very clearly defined family roles and expectations. Again, some of this comes from the religion, and a lot of it comes from the individual culture of the family or the community that you're working with, dependent on the country they come from, dependent on their ethnicity, depending on the, whatever tribe or caste or country or religion. I'm sorry, they all have the same religion, or sort of racial identity they belong to, right? They could be African Americans, or they could be, white. They could be Middle Eastern. So it depends on what they're bringing into that identity. The very strong family values about autonomy is discouraged in children. And this is something that was very evident to me when, growing up, we were not encouraged. Even now, within my community, which is also a collectivist community, we do not encourage children being outspoken, right? So when within a family sort of a group, children are not expected to be heard. There's the elders are sitting over there. It's not respectful for a child to express their opinion. Whereas when I came to the United States and have lived in other, first world countries, right, in the developed countries, quite often children are encouraged to express themselves, encouraged to voice their opinions, and it really plays into their sense of self, the confidence, or as well as the way that they respond to others around them. So a lot of children within Muslim communities may harbor a lot of resentment, may have feel a lot of powerlessness because they're not given permission. It's not acceptable for them to sit in an environment and really express how they're feeling or what they're thinking, right? And if that permission is not given, and I'm not saying it's good or bad, I'm just saying that's the way it is. Sometimes, again, based on the individual family and their rules, but quite often these children grow up with a lot of resentment and rage within them. So, when they become in their, in the teens and their early young adulthood, we see a lot of behaviors that the family comes and says, oh my God, he used to be a really calm child. I wonder, why he's behaving like this. And I'm thinking, of course, what you saw as a calm child was somebody who was probably feeling extreme powerlessness. And now this child is in an explosive stage of his being. So he is acting out in school, he's getting into fights, he's, abusing substances or doing whatever else he needs to do to cope with the situation. So kind of keeping that in mind as well. And I have provided these two case studies just as some, for me, it's always, I like to learn when I can put the learning to a face, to a person, to a real person. So these are two case studies I provided from the two clients that I've worked with. And Mariam is a 19-year-old married Muslim Moroccan woman. She was married to a U.S. citizen. This was a situation of domestic violence. She was married and she came to the United States. And there was a pretty intense amount of physical sexual emotional violence, not just by her spouse, but her mother-in-law as well, and her sister-in-law. And she was finally found actually roaming the streets in winter, shoeless. That's when she was picked up by the police. And this was the first time that I, the story I provided is the first time that she was found by the police. After this, is the story gets interesting when she was actually taken into the hospital to get her checked out based on her injuries and her she was in a really bad physical state. She had injuries over her, but she was also hungry and hadn't eaten for a couple of days, and she didn't look very well. And when she was taken to the hospital, apparently there was a nurse in the hospital who was from the same community as she was. And she basically told her that, why would you call the police? You could have resolved this, within the family or gone to the imam. And why would you involve an external, body? This was a nurse, right? So I'm thinking over here, I know as social workers and not, I know that there are other professions don't have these sort of ethical oaths that we take, but as a social worker, confidentiality and boundaries is extremely significant. And so I'm thinking, like, what were you thinking when you told this person, that what they and what they did in terms to keep themselves safe? And she didn't even call the police. The police found her, right? So long story short, this nurse took her home actually, and because Mariam said, I have nowhere to go, so I have to find, I have to go wherever the police take me. And she goes, no, don't worry about that. You can come home and, and we'll talk about this and we'll figure out how to fix the situation in a way that, that all parties concerned are happy. So Mariam went home with this nurse. And basically in the next couple of days, there was a conversation between multiple conversations where the nurse actually involved the local imam, brought the imam in, and the imam basically told her, like, you don't want to kind of get into trouble with this marriage. Marriage is very important, et cetera, et cetera. And so let's call your husband and have a conversation. He'll agree not to do this again. And what happened was terrible, and it's not going to happen again. And, she went back to her husband. Well, she went back to her husband, and the abuse, unfortunately, did not stop. And she, again, was, had the neighbors call the police, and that's where she was, brought to us. That's when I saw her the second time round. So to understand a situation like this, right, and it's not unusual, and many of you may have already seen this within the clients that you work with. I know I have seen many, many situations like this. So this was just one of those textbook cases where it is important to understand that marriage for Muslims is normative behavior, right? It's a socially sanctioned form of sexual activity, because there is no dating or any, acceptable sexual relationship prior to wedding, prior to a marriage. So a female, a child, and a male, very early on in their life, are socialized that marriage is going to happen. And somehow everything seems to be sort of, the marriage is central to their existence, to the religious practice as well. So a lot of times, you'll hear mothers saying, if you don't do this or that, you'll never find a good husband. Or if you don't, learn how to do housework, for example, or do well in your studies, you won't end up in a good marriage. So somehow, no matter what you do, it kind of relates to your identity in your marriage. And, even though I say this very strongly, I really want to caution each one of you, as I caution myself, not to put everybody into this box, right? So we want to understand what the client's idea of marriage is from their perspective and how they see themselves in the marriage. But in my experience, I've learned that the marriage is a tremendously significant concept and identity for women and men, as well as men. And because in the Quran it says marriage is half your religion and the other half is fear of Allah. So if the fact that you get married itself, you really conform with 50% of being loyal to your religion. So you see how important that is, right? And the other is fear of Allah. In other words, is following Allah's path in doing right, living right, and doing good, right? But once you get married, half your job in terms of your religion is done, and therefore people take a huge amount of effort in seeking to remain married. And when there is abuse in that relationship, it really complicates things, right? So the meaning of Islam, like I said a little while ago, was submission to God. So now in addition to submission to God, once you get married, you have to submit to your husband, right? And to the will of the Muslim community. So it really ends up in this complete negation of the self. So you're submitting to all these multiple kind of identities, yeah, to God, to your husband, to the community, to your parents, doing all the right things, doing everything to keep your marriage intact. And so then where do you then exist as a human being? So there's a complete negation of self, right? And that quite often when you see people coming out of the marriage, they reach that point of saturation where there is either an understanding that they will be completely annihilated, right? So research shows us that the time that a woman breaks the marriage or asks for divorce, right, is when she either fears for her own life or she fears for her children. So this is important to remember, that you may be trying to explain how dangerous it is or how challenging it is for her to be in this marriage, or how it is a really bad situation. But understand that in her mind, it's really difficult to come out of that, right? Because she has all these other challenges that she's dealing with. And quite often a man can divorce the wife, right, by saying talaq, and 3 times, and it can happen over, sometimes it's, what the Holy Quran says, it has to happen. The first talaq comes in, then there's a month, and then another one, and then a month. So it happens over period of 3 months, so that husband and wife can choose to sort of work on it. But usually, quite often, quite a few people just say it together, like talaq, talaq, talaq 3 times, and the marriage dissolves, right? So it becomes very challenging. Now, in an abusive situation, if the husband doesn't want to divorce the wife, right, what does the wife do? There is a sort of a policy that she can ask for divorce. It's called khula. But in many Muslim countries, there is a judicial, court, a decree that is granted by an Islamic court, whereby a woman can ask for divorce. But in the United States, there aren't, these Islamic courts, right? So a woman has to go, like my client did, like Mariam went to the imam. And once the imams get involved, not many of them are educated in domestic violence and understand the trauma around it. So they then advise, based on their religious understanding, to keep the marriage intact. And we all know what happens when that happens, right? So it doesn't always work, and there's additional obstacles for women to leave that. And the second case I presented was with substance abuse and mental health for Akram, who's a 20-year-old single Pakistani male. And this is the last piece I'm going to talk about before I go on to the cultural competency piece, just so I address the 2 issues of mental health and substance abuse. So he was 20 years old. He's in a family where his mother is extremely religious. His father is an atheist. He abuses substances and has prescription pills primarily as well. He also consumes alcohol. They found alcohol in his room. There were plenty of bottles stashed under the bed. His mother was devastated. His father, didn't know how to respond. He also brings in, women at different points of time. He says they're his girlfriends, but his mom doesn't see, the same person more than one time. And it causes a lot of distress to her based on the religious sort of, upbringing and what she believes the Holy Quran prescribes in terms of, marriage and lives with, with the spouses. So this is absolutely rubs her the wrong way, and there's a lot of conflict within the home. So I want to quickly address, what that means, these are there in the previous slide as well, in terms of how you can address these questions, mental health questions, with your clients when you're working and you're doing the appraisal tool, how you can kind of preface your conversations, remain respectful, but also you need to get your information from them. So these are some ways in which you can, based again on the way that you feel comfortable using your language and the way you present it. So in terms of substance abuse, there are religious implications. So from the Holy Quran does not accept using alcohol, right? It clearly says that it is prohibited. It's haram, as we say it. So it's haram. It's some places they say it's prohibited during the prayer time. Some places it says it's it's tolerated, but it's only tolerated when it's khamar, which is a forbidden beverage, and khamar actually translates to meaning alcoholic beverages that are derived from grapes, wheat, or barley. So quite often the client will come and tell me, oh, what I'm drinking is not khamar, so it's okay. So they'll find different ways to kind of explain and explain that it's not really against the religion. So there are different ways that people, it's a very controversial topic about, alcohol is accepted or not accepted. I think what is important for us to remember as providers is that there are reasons why it is discussed in the Holy Quran. So when it states that a human being's relationship has to be with God one-on-one directly, right? It is understood that when somebody intakes alcohol, the brain or any substances which fog their ability to think clearly, speak clearly, connect with somebody clearly, that is what is not acceptable. So anything that diminishes your ability to relate clearly with another person, to communicate and connect with another human being or with God, is really something that is not approved. The second piece of it is that when there is something that you know is harmful to your body, and this body is given to you by Allah as a gift, then intaking anything that is abusive to your body is also disrespectful to Allah. So that's how I, kind of try to understand it. And as a non-Muslim, I would never, tell my client what I know, because I don't know, much. I know a little bit, but I don't know enough to really have a conversation with the client. But more importantly, I want to know what the client knows. So I would say something like, when I read the Holy Quran, I thought and which I have read, I continue to check in with it, but that was how I first began understanding what the religious book actually entails for our clients. And I remember telling the client that, I read somewhere about this, and there are a few passages in this presentation that I would refer to afterwards that I would use and say, hey, help me understand, what does it mean when it says that this is not something that Allah approves? Like, how do you understand that? And I want to understand from the client their perspective of how they see themselves abusing or using alcohol and other substances, and how have they explained it in their mind, and how do they actually understand the religious text if they are a practicing Muslim. If they're not a practicing Muslim, then I'm going to ask about how they feel about being within a community that has such strong opinions about this, and how do they kind of respond to that. So it really gives me a sense of how they look at the world and how they look at themselves within this environment. So some of the coping mechanisms, unfortunately, because as we know, and we had talked about Islamophobia in the last presentation, there's a large number of reasons why this community is traumatized, right? Whether it is, if you're looking at immigrants and refugees, we look at the pre-migration, migration and post-migration trauma. We're looking at childhood trauma. We're looking at the trauma of living in a country where you're not accepted, where there are microaggressions every day, every hour, every minute, and you are living every day in fear because of who you are, because of how you look, because of what your name sounds like. And so all of this complex trauma, sometimes because of this, clients utilize substances to cope with it, right? So these are sometimes coping mechanisms in response to the trauma that they're experiencing. And there's a huge amount of shame and guilt that comes with it, because if they are religious and they know that what they're doing is against their religion and they feel like that, then they harbor that shame, that guilt within them. And that is not conducive to recovery, right? That is not conducive to leading a life in a healthy fashion. And many of them who are not religious also embrace that from their environment. So they're in an environment that's constantly telling them that what they're doing is completely wrong. And therefore, that is where the shame, even though they may not speak to you, they may defend their use of alcohol within themselves. I'm not 100% sure if they're absolutely okay with it. And because it's so stigmatized within this community and there's such a huge taboo to it, there's a huge amount of lack of literacy, right? So people are not talking about substance abuse. People are not talking about how to manage mental health. And then they end up sort of coping with these unhealthy mechanisms, right? So some of the somatic explanations of substance abuse or mental health, and I want to make sure that I probably did not include one of these slides that is there in the previous presentation on mental health and their idea of what causes mental health. So I'm just going to cover that really briefly, and you can go back and look at the slide. So for this community, mental health is a reason. It could be a biologically, biomedical reason, right? It could be something that genetically you're predisposed towards it. There could be a chemical imbalance, and there is an understanding that that could be the reason. There is psychosocial causes, which are considered the most important. So people will talk about stressful life events, or something bad that happened in the family, or traumatic childhood events that may have caused it, loss in the family, and therefore so and so is depressed because they have lost their job, or they the marriage didn't work out, or they have a child who's very sick. So whatever that is sometimes given as a reason. There is a huge understanding of religious causes, where quite often, and this is something that's not talked about, but if you ask the right questions, you will be able to understand your client's understanding of their mental illness, right? So it's felt as a spiritual dissonance. So they feel as if they haven't been religious enough, and there's been some moral transgression that has caused them to be sick now. They have not, they failed to really adhere to the tenets of God. They've not listened to their imam's advice or not followed through, and therefore they are sick like this now. And then there is, of course, the idea that they've been possessed, the demonic possession. You may have heard about jinn possession. I hear it very often. I actually got a call the other day from a colleague who's a therapist herself, and she called me saying, could you work with one of my family members? She is in an interracial marriage. She's a Caucasian married into a Muslim family. And she says, I have this family member, a sister-in-law, who, there are three sisters. The older sister is completely convinced that she is possessed by the jinn, refuses to go to hospital, is in danger of hurting herself, but is not able to seek treatment, won't go and talk to anybody but the imam. She had a history of domestic violence. The husband, interestingly, is now suddenly become this religious leader in the community, and is and she despite all the domestic violence, has actually never left him, and she's been with him. She used to have a very high functioning job. She was in the pharmaceutical industry. She quit her job, didn't want to work anymore, completely isolates herself. And the reason she had reached out to me was, I don't know how to take her to get some help, because the other day apparently she took a knife and she started slashing her legs because she thought the jinn had inhabited a part of her leg. There's a specific area where she was slashing away at, so they had to take her, call the ambulance, call 911, and take her into hospital. So these situations become very difficult because you can keep her in the psychiatric unit because she's in danger to herself, and then what happens when she comes out, right? Then unless she really believes that there's other ways of dealing with this, there's not going to be permanent change. And with this current situation, when I was asking her about this and all her behaviors, she's highly OCD. She has other distressing behaviors as well, severely depressed. So I kept, because of my experience in working with trauma, I asked her, can I ask you something which is a little intrusive, and you don't have to answer, but I just need to ask you to understand her behaviors. Was there any history of sexual abuse? And she said, that's a really good question. I don't know, because she's my older sister, and I have many years, between us, and in our community, obviously, we don't talk about it, but I'm going to find out and get back to you. And long story short, there was actually significant sexual abuse when she was little within the family. She was a victim of incest, and then then domestic violence. And in my understanding, this was her way of coping with you know with her psychological status, right? With the trauma that had happened to her. And this was a way for her to explain it, understand it, and get it socially sanctioned. Within the community, the jinn possession was something that people didn't question. Like, okay, you do whatever is required and you do it. But you can't tell somebody that I'm a victim of sexual abuse and I'm severely depressed or I have PTSD, right? That's going to be frowned upon. So it's very interesting how people, as human beings, we have ways and means to cope with our traumatic events. And I had a very similar event with another client, but I'm not going to go into that because we need to move on. So this is in terms of coping strategies. There are somatic explanations. You'll see a lot of people coming in with medical sort of complaints rather than psychological complaints. You'll never hear them saying, they'll probably say that they feel like a little depressed. Now they're living in the US, they pick up on these words, and I've heard them saying, I feel depressed. And I'm like, what do you mean by that? Help me understand what depression means to you, right? Because it means different things to different people. They quite often rely on religion and really praying, going to the imam, understanding what the religious text says, things like that. Family is huge, reaching out to others. Isolation is key. So if I'm working with social service workers, I always tell them, connect people to others, connect them to the community, connect them to the mosque, connect them to local cultural events happening, or cultural agencies that provide certain community events that they can engage with. Because one of the things that I fear the most is isolation. Isolation is really, really a risk factor for families and individuals in recovering from, whether it's migration, whether it's living in a new country, living with any kind of trauma. And they quite often say, the belief in bearing, the strength of bearing it rather than trying to change it. And the Holy Quran does talk a lot about patience, having patience and to bear it and to suffer it, because Allah is testing you, right? And so you have to bear it. And when you look at that, in one way, it can be a tremendous strength that a person has the capacity to really bear it, which is coming from the religious belief that if I can only get through this, I'm going to be okay. But it can also be a huge weakness, because then they get stuck in it. Because if they believe that Allah is going to take them out of it and everything is going to be all right, and Allah will take care of my family and me, and will find me a job, or find me a home, then they become stuck and they become powerless. So one of the things that I have done in sort of addressing this is I tell them, very with a lot of humility and respect, that I don't know their religion, I'm not part of that culture. I say, well, doesn't it say something, the Holy Quran talk about the camel story? The camel story is basically, the Holy Quran says that if you take the camel out in the desert, and if you tie the camel will be safe. So your job is to tie the camel, and Allah will make sure that the camel is safe. However, if you take the camel into the desert and you don't tie the camel, the camel will walk away, will get lost. Somebody may steal the camel. And so Allah can't take care of that. So basically what that means is that as long as you do your part of it, Allah can take care of the rest of it, right? But you still have to do your part of it, which is to make every effort to make your life change for the better. So this is something that I use, quite often in helping address the issue of perseverance, of patience and perseverance, and sort of patience and actually persevering, instead of just bearing it without any action. So now we come to the cultural competent appraisal piece of it, is really understanding what that means. And for me, I would really describe it in 2 words. It's being open and being curious, with the right amount, genuinely open and curious. And if you are able to do that, you'll get so much information from your client that while doing the tool, and I mentioned this in the last appraisal, that when you're asking open-ended questions, you get a lot more information from your clients than if you were asking one question at a time, right? A yes and no question, then clients tend to not, one, there's confusion, not understand how much they're supposed to say. Two, there's a trust issue, is how much should they be saying to you. Three is what are you going to do with that information. So making sure that you're discussing confidentiality and your role and why you need the purpose of this appraisal and why you need this information. All of that is extremely clear. But along with that comes your role as a human being, apart from your role as a professional, where if you have the ability and the will to respond to the needs of the clients, which arises from their culture, right? And you and the client can work together in building their culture as a resource, as a strength, right? To meet their needs, your job is done. So I really want you to focus on the words ability and the will, right? Those two are significant in you being able to do effective work and really collaborating with the client and not thinking that it's your job to fix all the problems in the client's life. It is a collaborative work with the client because it really is their life, and quite often it is really they who know best. Until unless they are mentally disabled or they are in other ways incapacitated, they really know what they need to do, whether they're expressing that to you or not.
Rupa, it's about 45 minutes in now.
Thank you, Christina. Ethic versus emic epistemology. So this is very interesting to me when I teach cultural competency, because initially, Laura Brown, she's a psychologist, has done an immense amount of work in this, and she talks about earlier, in many years ago, in the 60s, 70s, the 80s, we used to really look at cultural competency as really trying to understand the community, the group, right? Looking at the similarities, and then we set a set of clinical rules or behaviors that we would relate people with, right? So sometimes it creates some overconfidence, and you can look at your own selves. That I know that I get very nervous when I'm working with somebody I have never worked with before or have very little understanding of their culture, right? So that sometimes people will say, oh yes, I work with this person. It creates overconfidence. So if I'm a South Asian, then I say, oh yeah, I'm South Asian, I can speak the language, I can work with this person. That's not true, right? Cultural competency has nothing to do with knowing the language or belonging to that community. I have a lot of South Asian colleagues who are really not culturally competent. I have a lot of Caucasian white folks who are colleagues of mine who are significantly more culturally competent. I would very happily send my clients to them. So really it creates overconfidence. Sometimes people refer them out. Oh, I've never worked with somebody from, let's say, Chad. I don't know anything about them. I'm going to refer them out to somebody else. So either way, it's not really something that works for. We don't have those luxuries in our work, right? We have to figure out ways to work with them in a culturally competent way without knowing everything about them or thinking that we know everything about them. The other piece of it is the emic, where there is no assumption of a specific human behavioral norm, right? And both parties together work together in co-constructing the meaning of their experiences. This, I think, is extremely significant in the work that I have learned to do, is really allowing myself to listen to the client and to be able to work with the client in co-creating, right, their experiences, so that I can use or utilize that information to help prepare my work. So there's you're not assuming a stance of expertise, but just of curiosity and ignorance. It's okay to say, I don't know, help me a little bit. But again, saying that, I would say caution you, because you don't want to go in with absolutely zero information, right? You want to be able to address that in a respectful way. Do your little, homework before, read up, as we call them, country studies. Before I meet a client from a country that I'm not very familiar with, I'll pull it up, on my computer and I'll do a little country study about their rituals, their practices, their belief systems, things like that, religion, what does that mean to them, just so I have something in my mind before I have a conversation with them. I will not, stereotype them or put them and think that, oh, people from this community, believe that, marriage has to be in this way. But at least I know a little bit enough to, if I'm hearing something from the client, I'm going to say, help me understand it a little bit more. Could you speak to me a little bit more about that? What does that mean when you say that in your family you have arranged marriages? Is that only within your family, or is that within your community, or is that part of your religion? Like, help me understand that, right? So whatever that is related to their inability to stay in a marriage or affects their financial status, which then impacts their ability to be employed or not. So this is a analogy I use is this glacier, right? So you see this glacier, and you see all this thing on the top that you can actually see, and then the bottom of it, right? You can see this part of it that's not visible to our eye. You can see this, which is very evident. So this is the visible culture, and I use this to teach cultural competency because it kind of keeps it clear about, how much is it that we know, and all of this that we actually don't know, that we have to figure out with our interactions, through our interactions. So this is where, the emotional loading is very low, right? So things that are evident, you see the person's language, you see their music, food, whatever is evident clearly in front of you. So there are few ways to make misunderstandings about that. Then comes the unspoken rules, where there are extremely high emotional loading. The violations produce negative feelings. So for example, you're asking a client to come in at a certain time, they're coming at a different time. I'll give you an example from my experience. We used to work with a large Muslim population. Many of them were young men and young women who were seeking asylum. They were immigrants, and they were refugees as well, some of them. So we would invite them to come in. Food was a great way that we would engage with them. And so we would invite them to come in at 11 o'clock so that, staff and clients, we would all eat together, and we would just try to kind of, normalize some of the power dynamics and create some connections, right, with the folks. So they would come in at 1 o'clock, right? And it was very frustrating because staff were waiting to eat. We couldn't, schedule clients. We had clients who were coming in. We couldn't eat. We were waiting for them. This happened a couple of times. So one time I just went to one of the clients. I'd worked with them for a while, so I felt comfortable. I sat down with him. I said, Mohammed, just tell me, like, what is this deal with, we call you guys at like 11 o'clock. And this was a group of, people they would come together. They lived in the community and they would come in together. They were all our clients. And he would say, well, I said, you come in at, invite you at 11, you guys show up at 1 o'clock. Like, what am I missing here? And he was like, well, we don't, if you call us at 11 o'clock for lunch and we come at 11, it shows like we are hungry. We have no food at home. And that's very disrespectful to the host. I said, oh, okay. So help me understand that, right? So we talked about it, and I realized that actually in my country where I come from, that's pretty much the same thing. And I guess being in the US and being abroad for so many years, it didn't come into my mind that that is really a cultural sort of a norm where somebody, and we laugh about it, we call it the Indian Standard Time. Somebody calls us for dinner at 7, we show up at 9, and that's okay. Whereas with my, with my Caucasian white clients or my American friends, if they invite me at 7 o'clock, I show up at 7, right? So it's weird how we kind of switch our ways when it, sort of with different people. And he clearly said it shows it's very disrespectful to come at a time when you're called, because it shows like that you're hungry and you're going to pounce on the food. And the way he said it didn't make sense to my staff, but it made complete sense to me, because I'm like, yes, that's exactly what we think, So we go at a very fashionably late time to show that we actually have plenty of food at home and we are just coming to be courteous to you and show respect, and not because we are like dying of hunger. And somehow that's disrespectful, right? So those are things that you won't know until you ask, right? And you look at these and understand these social behaviors and how they kind of impact a person's sense of self and their relationship with others. And then the last piece of it is the unconscious rules that are completely lower down. And these are the ones that cause a lot of difficulties in relationships. And this is something that I think is very relevant to you folks, is, this touching, space, body contact, tone of voice. So many of you had asked questions about, if you're having somebody coming in, the husband and wife, and you really want to talk to the wife, or you have to talk to them together. And those are those norms that is difficult, right, to address, because within this culture, usually, families are accompanied by a male person. If the male person is not there, then it's usually an older female, right? And how do you kind of, connect with them in a way that's respectful? If you're a male social service worker, you do not want to shake hands with a woman. And likewise, if you're a woman, you don't want to shake hands with a man. Physical touch is taken very seriously, and there are clear rules around that. Again, community to community, family to family, that might differ. But to be on the safer side, I would just advise you not to engage in any physical touch or be very close to people when they're sitting with you, and keep a respectful distance. And in terms of even like, I guess when you want to work with the woman separately, you might and I've given you some ways to use the language and say, well, if you want, if you don't mind, I have some questions that I think your wife and I may be uncomfortable talking with a male person, because then that puts you in the same place as the wife. And say, as a woman, it's kind of a little uncomfortable. I always smile and I say it, and if it's okay with you, is it all right for me to have a private conversation with your wife? I just need to ask her some, health related questions, and some, questions related to her feminine, health. And I always say in a word that, makes sense to the family, that it's really about the, nothing that is going to be threatening to the male sort of position in the family. So whatever way you want to address that, be very clear that it's to do with her medical, or to do with her health, or to do with her feminine health, is something that has always kind of made sense. And again, if you're using a language about, that is familiar to the client, then you have to change the language accordingly, right? So even like if you're asking a question about substance abuse and you want to ask the man separately, and you think he may lie if he's in front of his wife, you might just want to very clearly, just say, separate the wife and say, I just had to ask a few, questions to your husband, if it's okay with you, just about, employment and things that are okay within this family for a man to talk about. And there are some things that are okay for a woman to talk about. So you want to be, kind of understand what those things are, and then separate the family. And I always encourage one-on-one dialogues wherever you may have the chance to do that. And with men, asking about substance abuse, you can just very casually ask about, what are your thoughts about alcohol consumption, and has it ever been a concern in your family? How do you guys, how does your family or your community look at this? Help me understand if there's been any history in your family where substance has been an impact in, has negatively impacted your family in some way. So keep it very general, and then you can make it more focused towards the person. Okay, so, and I'll take more questions about this if you have some specific things. So in terms of the cultural construct, this is the second most important thing, apart from the previous one that I talked about, the glacier figure, the locus of control. So this is how a person sees themselves and how they see the world. And you pretty much, if you have this in your head, you're good to go. Okay, so think about these four things. So locus of control, does the client believe that they have an internal locus of control versus an external locus of control? So even if you look at yourself, do you believe that there's a destiny, there's a fate outside that's controlling your life? Or do you feel that you are completely responsible for making whatever change that you need to do in your life, right? And you can, and so for a lot of people, there is a combination of both. But for many people within this community, right, there is a lot of external locus of control, right? Allah has determined what is good for me. It is my destiny. I have to bear it. So you're going to hear a lot of that, right? So how you reframe that into, so what does Allah need you to do to remain healthy? Because I know that He wants you to be happy and healthy. So how does He kind of, how would He expect you if you sort of feel like you're suffering, but you have to continue suffering for that, right? How does that impact your ability to move out from this? So quite often, the camel one, for example, is one example. The other example is in the Holy Quran. It clearly states that Allah has put providers, you and me, right? People who provide services to be able to help a Muslim individual and to help Muslim families. It clearly states that. And you can really bring that up and say, well, when I help you, it's not me who is helping you. Allah has put me in this place, right? There's a reason why I'm here. There's a reason why you're sitting with me in my office, right? Not just like nothing just happens just for no reason. And I'd like to believe that because what I'm trying to do with you, the work I'm trying to do with you, how I'm trying to help you is how Allah wants you to be helped. So really taking that external sense of control and making it an internal way where you can inspire and motivate them to do something about, their lives, right? So this is something that I've used constantly, and it has worked for me. Again, in a very humble, respectful manner. Concept of self. So in many communities in the United States, there's an individualistic, understanding of the self, right? So I'm responsible for my actions. I'm responsible for my future. Whatever happens to me, negative or positive, my failures and my successes are all mine, right? And I have to fix it, or I can take pride for my accomplishments. In individualistic communities, right? Remember we talked initially about the honor societies, and in honor cultures, many of these communities are honor cultures, and within honor cultures, which is a collective, honor again is a collective term, it really relates to the social behavior, not of one person, but of a collective behavior of a family. So when people talk about, oh, it's shameful for me to do that, or I cannot divorce somebody, or I can't leave that job, or I can't work because in my family, women don't work, for example, or if I'm a man, I don't work in certain jobs, it's disrespectful. So it's against the pride in my family. So those are, quite often, for many reasons, the honor cultures, right? And in an honor culture, it's important for you to understand that honor cultures, individuals within those cultures are responsible, not just behavior for themselves, but responsible for the behavior of other members of his or her family, right? Tribe, community, faith, or any other form of social identity grouping. So really, you can understand how much of a burden that can be, right? And so this licensing of collective social control that emerges from this honor, right? Or this understanding of honor. So when this is viewed within the context of patriarchal structures, you can imagine that it creates an intense form of oppression for women, right? So if you're looking at, domestic violence, sexual violence, things like that, when women think that it is not just their decision, but how their decision is going to impact other people in the family. So for Mariam, if I go back to Mariam's case, she did not want to get divorced initially because she was worried that her siblings are not going to be able to get married because now there's a divorced woman in the family, right? And I currently have a client right now who's a physician. She's a Pakistani young woman, beautiful, a doctor, and a victim of domestic violence. And she is so terrified of telling her family that she's separated from her husband and is living in a domestic violence shelter because her sister is scheduled to be married in September. And she says if her sister's in-laws find out, then they will break the marriage. So she cannot tell anybody that she's actually separated from her husband. And her husband is using that to get her to come back and follow through with whatever he needs her to do, right? So you can understand that it becomes very difficult. So when people say, if she's in an abusive relationship, why doesn't she just leave? You have to understand how this individual perceives themselves. And when they come in a collective structure, it is about what the family is going to think, what your children are going to think, what your siblings are going to think, what your parents are going to think, what the community is going to think, right? Because now, even if your parents are supporting you, they have to be your face for the community. And the community will tell them that you have not given values to your child because now look at how, they failed the marriage. It doesn't matter whose fault it was. If there's the person is in jail, it doesn't matter. But your daughter now has a failed marriage. And so a lot of times women and men as well are stuck in situations because of the way they perceive themselves within this environment. And then lastly is the power distance. The power distance is low versus high. This is very significant for you guys to know, and I'm telling you why, because you sit in a position of power, okay, each of you, and so do I. And as a service provider, we hold a lot of power. In communities where there is a significant high power distance, which means that any authority figure, government official, school teachers, educators, people who are in roles that they have a position and a title and hold power, that relationship with that person is very different than in what we see in the US. So quick example, in the US, even when I teach in class, right, when I have graduate students in class, We encourage students to ask us questions. We encourage them to question us and challenge each other, and that's how we learn. But in many of these countries and communities, it is not encouraged that a child, remember I talked about children speaking up, children are not encouraged to question and challenge educators, right? So even when they come in a graduate level program, they don't challenge and they don't question their professors. It's just not what they're raised to do, right? That's not the system of education. So when they come here within this community, when we see children, in schools, right, and the teacher and the school is writing letters to the parents are actually not coming in, we are like, oh, the parents are not interested, they're not engaged. It's not because they're not engaged or interested. They are terrified probably, or it is not within their understanding that they can actually question the teacher and say, hey, why is my son not doing well, or what can we do differently? That's the high and low power distance. In the United States, we have very low power distance, right? In some scenarios, absolutely, but in most scenarios, we have the freedom to question each other, to challenge each other in respectable ways, in appropriate ways, but we still can do that. In the Muslim communities, the power distance is very high within the family, outside of the family. So for you, therefore, it becomes very significant when you are engaging with your clients, and if there's a high power distance and in their head they're like, oh my God, this person is completely, pardon my language, bullshitting, they're not going to tell you on your face, right? They're going to be respectful and they'll say yes, yes, yes. So we had clients who, we would set up appointments for employment interviews, and then the caseworker would call me and say, hey, Rupa, your client was supposed to go and they never showed up. So when they came back and I'm like, okay, so you had an employment interview. This was, they worked so hard in finding you this place. Why didn't you show up? He said, well, you said to go, but I said yes. I didn't say I would go. I just said, my yes means that I heard you. And this came after a lot of back and forth. It's like, help me understand why, I thought I had explained to you. What did I explain to you? Which part of the information could have explained to you differently? Maybe I didn't understand. So there's a lot of back and forth. This is the bottom line. Is when I say yes, it means I hear you, I respect you, I'm in the room with you. Yes does not mean yes, I agree, yes, I'm going to do it. So just be very careful about that. So in terms of practical tools, engagement, building trust is essential, and many of you have experienced that. The trust with this community for various reasons is absolutely crucial. This is a community that believes in community work, right? And so trust. You trust your family, you trust people from the same faith. And so when you come across them, somebody who speaks different, looks different, does not belong to the same culture or religion, there has to be extra effort in building that trust, right? Clear boundaries, clear ethical understanding, confidentiality, being honest. If you can't follow through with something, don't say it. Because once you break that, they'll not trust you again. Right? And this is with any client, right? This is not just with this community. So whatever you're not sure about, you can always say, I cannot promise you because I'm not 100% sure if this is actually going to happen. But what I can promise you is that I'm going to try my level best in making sure that this service is provided to you, or whatever that is, right? This is something I say all the time. I never ever promise, even if I know that this is going to happen. I never promise anything because we really don't have control over so many things, right? In the work that we do. Acknowledging the cultural and the power hierarchies, acknowledging that there is within the family these gender differences, these age differences, and the power that comes with it, expressing empathy, validating the information. So really understanding that I'm different and putting it on the table, and with empathy and respectfully explaining that, this is not something that I'm familiar with. Can you help me understand so that once I understand it, I can then better be able to problem solve with you, right? Communication, greeting, respecting gender differences, and all of that we talked about. And then the use of language. I don't often use the word domestic violence, suicide. I don't use mental health at all. I always kind of talk about general health, and then I move into stress and how you can, address stress and how do you manage stress. I don't talk about domestic violence. I talk about, sometimes there's conflict in the home or healthy relationships. So, how do we work towards healthy relationships? How do we, kind of address the, a person who's feeling very desperate and wants to harm themselves. Now, understand that if they're second or third generation Muslims, they're very familiar with using domestic violence and suicide, and they're very comfortable with it. Very familiar terms to them. They're very comfortable with it. So don't assume that not everybody is familiar with this use of language, but especially when I'm working with my older immigrant families or my older immigrant individuals, I just try to kind of play along the language to keep it positive and not make it, because I want to kind of judge their reaction to it. And all of this is one thing, right? Non-judgmental. Trying to put your own biases, your own prejudices on the side, right? To be able to be present with the client and listen to them a little bit, filtering out all the other stuff that you bring into the room with you. Okay, I'm not going to go there. This is a slide that I usually use when I'm working more with like clinical people, but it's something that you might want to read up on if you're interested, but it's not something that's absolutely, critical for you to know. But sometimes these are the words that clients use, and just to understand what they mean, this is something that you might want to look at. So I have a few slides with some questions that I've put out for you to take a look at. And again, these are questions that I use, but when I change them into the different languages that I speak, they sound a little different. So based on how you feel comfortable using language, feel free to use these words. And I know that in different languages, these words come out differently. So just as long as the theme or the essence of what you're trying to say comes across. This is one of the tools that I use, the Culturegram, and it's pretty clear over here. And this is something that I use to do an assessment as well, along with the genogram. That really helps me understand the family and some of the family dynamics, but also belief systems, rules, their migration, post-migration sort of journeys, all of that. So this has been very helpful for me. Again, I have a few slides with some Islamic teachings that I keep in my desk as a cheat sheet that I just read up and make sure that if I'm seeing somebody who is depressed or has suicidal ideations, I tend to use some of these texts just as a background, just to kind of say, for example, if I'm looking at somebody who is extremely feeling desperate, right, and I feel is losing all hope, then I would say something like, in the Holy Quran, does it talk about patience, sabr? I know the language, so it's different, but you can always say about patience, what does it mean, when it says, to Allah we belong, to Him I've read it somewhere, what does that mean? And help the client process that with you when they're feeling super desperate, right? So these are some portions, things that I've used in my work with them, and you're free to look at it or look them up in the Holy Quran. If you're working primarily with this population, I would highly recommend and encourage that you sort of read the Holy Quran if you can. I benefited a lot from it, and I know that it really helps you to connect with the client. So again, some of these risk factors that we've already talked about, so I won't go over it. Just one last piece, the use of interpreters. I know that you have struggled with this. Many of you have questions about interpreters. Do not use family members. Do not use children. Do not, absolutely. There's no like, oh, what if a child is like 18 years old? No, do not use any family members, period. If you can, I would encourage, the worst is the language line, but if you can schedule for professionally trained interpreters, those are the best. It has to be verbatim translation, no paraphrasing, no using professional terminology, and really verbatim, speaking in first person. So if you are trained as an interpreter, and if any of you have a second language, please take the training, because if you can take the training as a community professional translator, you will know how to utilize another interpreter. I'm trained in like 3 languages, but when I am with an interpreter who speaks a language that I don't speak, it really helps me to use that session in a very positive way, right? So just understanding how an interpreter who's trained is actually supposed to use their voice. They are just a voice. They are not just, I don't mean to diminish the importance, I'm just saying they really just are a voice. They're an instrument in the room that you're using, if the primary relationship forms between the interpreter and the client, you've lost that connection right there. The primary relationship has to be with you and the client, and the interpreter is the voice. So I have, I talk about positioning. So just because we are doing a webinar and I can't role play for you, always make sure that the interpreter is sitting behind you, not directly behind, but at an angle where they're not able to really make eye contact with the client. The eye contact is made between you and the client, and the interpreter is really a voice that is listening very carefully to the client and interpreting and listening very carefully to you, and really not making eye contact with the client, because that's where, anybody who knows a language, you tend to connect with them first. So to avoid a relationship happening between the client and the interpreter, you want to make sure that all of the conversations are happening behind you, where you are actually talking and looking at the body language of the client and connecting with the client, and not the interpreter. I cannot tell you how important this is. So that's pretty much what I wanted to cover for you. And these are slides that I just put in because it's something that you can go back and read and just kind of remind yourself, also refer to it in future when you want to go and check in and see some of the stuff that I use it as a framework for myself. So I put in these slides, but we've already covered most of it. And I just, lastly, just to keep in mind that just recognize the diversity, recognize that they're not homogeneous. They're a very different community with diversity in their thoughts, in their belief systems, in their rituals, in their practices, in the way that they practice the religion, in the way that they don't practice the religion. So just avoid stereotyping, avoid putting them all into one box, and just, build up your own awareness as well of yourself and your own biases and prejudices, and also reach out to the Muslim community and connect with them, because that's the best way to learn. Is all these trainings are great and I'm happy to do them, but the way that I have learned is through my clients and through engaging with the community, going for their events, eating with them during Eid, celebrating with them. That's how I, as a non-Muslim, have learned to connect and feel comfortable with this community. So I've put in some video resources that you can watch to learn more, as well as some of these websites that provide an immense amount of information that I have found very, very helpful in understanding this population. So that is done on my end. Please feel free to ask questions. And again, whatever we cannot complete today, I will fill in and send that, and Christina and Brianna can post on the website on your page. I believe that I had answered some of the questions that had come up last time about men, about the employment piece of it. And just to remind you that there is no clear injunction from the Holy Quran about employment, except that you cannot take a loan and pay interest on it. So it becomes very difficult for people when they're buying cars and homes as new immigrants, because they have to take an interest-free loan. That becomes a challenge even when opening new businesses. And I would avoid putting them in factories where they're processing pork or alcohol handling factories. Other than that, and sometimes I've had clients who've done that because it's more important to feed the family, because that's what Allah and the Holy Quran directs them to as well, taking care of the family. So they have done that work as well. But if possible, to avoid certain jobs, these are the jobs that are directly concerned with their religion. So that was the question. I don't know if anybody else has other questions that I did not answer, because I don't want to go over all the answers that I've already written down and provided.
Sure thing, Rupa. Actually, we have a couple questions, but before we get to that, one more piece of logistics. Again, a reminder that all of the materials from today's webinar, the PowerPoint slides, the handouts, the recording, the transcript of these Q&As will be posted on the Learning Center. All right, so Rupa, I have a question for you.
Sure.
I have a client that I have been trying very hard to engage. He does not drive and tells me that even everywhere I try to send him for ESL classes is too far for him. What would be the best way to ask him why he does not feel comfortable riding the bus and taking BART?
Okay.
subway system?
That's a great question. You know, what's coming into my mind is obviously I would want a little bit more information, but what I'm also thinking is, does his, and some of this is just resistance, right? So it doesn't have to do with religion or culture. It could be that individual's resistance for whatever reasons. So I'm wondering, sometimes one of the things that I've seen in my clients is that if there is something that interferes with their prayer times, that becomes an issue, right? So what I'm hearing is that your client is not wanting to take public transportation. Is that the question? Just tell me again. Sorry.
Yep, it is. They don't. Well, they're not. Seems like he's not comfortable riding the bus and taking BART, which is both public transportation. Yes.
Okay. So I would then ask him a little bit more about that and say, you know, can you help me understand why is it difficult for you? And because, you know, we live in this country and I'm just so used to it, maybe I'm not understanding. So help me understand why, you know, public transportation is not, you know, acceptable to you, so that I can problem solve and figure out how other ways I can do it, because that could be related to other things. You know, he could have had a trauma experience in a public transportation. He could be relating it to somebody in his family who got assaulted because of being a Muslim. It could be because he looks a certain way. It could be, you know, it could be multiple reasons. It could be coming from his fears or past trauma, or he thinks that you can provide him with money to actually take a cab, or, you know, buy a car. That could be in his head as well, that, oh, you know, if I say no, then maybe they're going to provide me with resources to actually buy a car or have my car. So I would try to spend some time understanding what is the resistance here, where is it coming from? Because it has nothing to do with the religion or any primary cultural beliefs. It could be in their family. You know, sometimes in some families in certain countries, it's very easy to have a car, right? So you don't have to be very rich to own a car. A lot of people, and again, I don't know the you know, the status of your the individual you're working with. Sometimes it becomes like a sort of a status issue, that you're taking public transportation versus having your own car within the community. So, but it could be one or all of these reasons. I would try to understand what exactly is his fear, and ask in a way that helps him feel that you're not judging him, but really want to understand so that you can problem solve with him. Does that answer your question?
I think so. I have another one. I have a female client that is declining to participate in employment search or educational training because she is not allowed to be around other males. What are some recommendations or options?
Okay. And that is sometimes quite significant, that women cannot be in the same room as men, whether it's, you know, whether it's a job training, whether it's, you know, whatever, it's an event. And in these situations, we have tried to do two things. One is that what has helped has, if possible, trying to do separate classes for the women. If this is a big population you're working with, if possible, you can separate the men and women. It brings a sense of comfort both to the men and to the women. So we used to have ESL classes where when we were just doing it with this community, we would separate, but when we would have them in with other communities, then we would speak with them. This is the second scenario, is sit down with them and say that, you know, would it help for me to speak to your family about this, and just kind of generalize that, you know, this is the availability, and, you know, we'll put you in a place that's, you know, kind of, you'll sit down in a place that's not in direct sort of contact with the man or eye contact with the man. So you can sit, so we would, in a classroom, we would position the women who were more conscious about the fact of being close to men in a place that gave them some sort of privacy, you know. So they were not making eye contact with the men, not being physically close to the men, not really engaging with them. Sometimes if I've had younger clients, I would ask them that would it help for me to speak to their parents or to their spouse, the family members, mother-in-laws, whoever, you know, constitutes that, and just kind of understand how it works over here, so that we can, the permission is coming from the family, because you have to be respectful of that. Otherwise, the client is not going to be able to really participate in any of these events, unfortunately. So I would, one, see if you could separate them to work with the family and the client and normalize it and make sure that you're able to uphold that honor of her, of whatever it is that she needs, in a way that's as much as possible doable within that room.
Thank you, Rupa.
Yeah.
You can continue to send in your questions. I have another question for you. How prevalent is human trafficking in the Muslim world or among Muslim communities in the U.S.?
That's a question that I don't have absolutely 100% sure answer. So I work a lot with survivors of human trafficking, and it's interesting because it's they're from everywhere, right? So survivors have been from everywhere. I have to say that I haven't had, and that's why I'm using a little caution in answering that question. I mean, I have had survivors who are Muslims, but I cannot say that they're in any significant way more or less than the others, if that answers your question. Again, if you're looking at the way that domestic trafficking happens over here and the way that young teenagers or young adults leave home, run away, end up in trafficking situations, I have not seen that with my Muslim population, right? Leaving the home, it's not an option. Running away, it's not an option. What happens in terms of human trafficking has been where a Muslim woman has got married, for example, has been abandoned by her husband, and then to be able to survive has been trafficked by other people. This has been one scenario. Another scenario I had was when a Muslim woman was married, and she wasn't married. She had a big family. She was trying to support them. She was a dancer in a bar, in a drinking bar, in her home country, and she was trying to. She wasn't prostituting herself or engaging in any kind of sex work. She was dancing, but that along the way, unfortunately, translated into her being trafficked overseas and asked to do what they called as dancing in these bars, but that then again changed into engaging in sex work. So it's different scenarios, but I wouldn't say that it's very common within this population. And quite often in countries where they are trafficked, it's usually from really low socioeconomic status where women are put into these situations because of survival reasons, and at a young age, or their families are involved in some way or fashion, but it's not in the same sort of, in my experience, in the same kind of structure as it happens over here. I don't know if that answered your question, but I would be happy to communicate with you more after this, because this is a really fascinating topic. And I'm actually, now that you've asked me the question, I really want to go and so.
All right, I think we have time for one more question. So
Sure.
They're asking for examples of employment opportunities for females that can't, employment opportunities, ideas, examples of job opportunities for females that can't interact with males.
Yes. So this is a fabulous question, and this is something that we actually had to do. And some of the things that really worked for us was engaging in some sort of babysitting, from home. So a lot of the other women who go to work, need to keep their children somewhere. So trying to do like some sort of a certification where they can have a license to do a daycare in the house. Catering has helped a lot, providing food. So a lot of our refugee women and immigrant women who did not want to leave the house or work with men in certain work environments were doing a lot of food businesses from home, catering services. They were also doing like knitting and like sweaters and caps and selling them. Then we also had, I'm trying to remember now, I'm sorry. There was one more, I'm sorry, sudden aha moments in my head. We also actually had them do beading, like necklaces and earrings, and we provided them with like the raw material, and then we had an exhibition where they actually sold some of these things. So these were these 4 things I think really worked well for our women in the community is engaging without much contact with men.
Perfect. So with that, I want to thank Rupa. If you find yourself that you have additional questions, I always do that a lot after the event. I go, oh, wait, I have one more question. Please feel free to send it into the OCAD help desk, and we will make sure they get answered. We have one more piece of business, and that is the evaluation feedback. But as you are completing that, I want to take this opportunity to thank Rupa. Thank you so much for your insight. We got a lot of comments. Thank you for those who sent in your comments. I'm just really appreciating your insight and your understanding, Rupa. And I also just want to thank the OCAD users for your time and attention this morning, afternoon. I know it eats into some of your lunch time, so we appreciate that very much. But please complete the feedback.
And can I just say thank you before we before we finish? Just thank you again to everybody. The work that you do. I know, like, I feel like it is an honor for me to do this work, and really has been an honor for me to talk to you about this subject. And good luck to all the work that you do again. And in future, if you have any questions, as Christina and Brianna mentioned, feel free to reach out, and you have my information. I'd be more than happy to support you in your work. Thank you again.
Thank you, Rupa. Oh, Rupa, never mind. The person actually left. They asked what happened to Miriam.
Oh. Miriam is actually doing really well. Her husband got 9 years in prison. He was prosecuted with multiple charges, sexual abuse as well as domestic violence. And she actually went back to school, and she was pregnant during this time. She also found out she was pregnant. So her child is now 11 years old, and she's still, she's doing really well. She's working, she's living by herself. She's moved out of state. And yes, so thank you for asking. She'd be happy to know that she's been a huge learning for me in my work as well. She's really provided me a lot of insight.
Well, thank you.